There are many problems and dangers of this. And if you look at different categories of medicines, one, you can medicate yourself with the wrong medicine. So the wrong antibiotic. Antibiotics are the biggest danger. Because what has happened is that you use the wrong antibiotic for a given disease or given bacteria, and the bacteria develops resistance, then it becomes a problem for the whole environment. And progressively you will see, because of injudicious use of antibiotics by our population at large and chemists giving on demand, that we now have the bacteria in our environment which are very resistant to most antibiotics. So that's a danger which we may have to face as we go forward, and particularly for the patient who has been repeatedly self-medicating themselves, they will themselves develop resistance to antibiotics, and the bacteria will become a major source of danger to them. So that is why one category, you can lose your life by actually self-medicating irresponsibly. Second is the point that there are other drugs which can be habit-forming, can actually be taken in the wrong doses. They can actually cause death by depressing the respiratory system. Overdose can happen. And then, of course, there are other related problems that can occur. If you get allergic to a medicine and you've taken it without the proper prescription, you can have a reaction in your body, allergic reaction, which can even be fatal. So I think that there is no benefit today in self-medicating yourself when medicine, doctors are available. It should not be on your mind, and it should be the responsibility of any advisor, any teacher, any doctor to actually spread the message to the public how to protect themselves from this urge or convenience of self-medication. I think overall this cycle must be interrupted, because it is going to lead to major dangers, not only bacteria-wise but otherwise, like addiction and false medication and reactions. The net and Google are a double-edged sword. People go on Google, they match their symptoms with that, look at the possible treatments, and then start self-medicating. Most importantly, no chemist, no pharmacist should be able to dispense without a proper prescription from a registered doctor, not just any piece of paper. Doctors' handwritings are not very legible, and many mistakes are made by the chemists in giving these medications. So it should be double-checked both ways that it is the right prescription, and that so e-prescription and e-dispensing would be the ultimate solution to safety in this procedure. See, video conferencing is one great multiplier. Whether it can be done by Skyping or it can be done by formal video conferencing. If that can be done, I think that's much safer, and then you can actually have a expertise multiplier. It is true that Lybrate is one of those platforms which is offering to connect people to doctors and get some opinions, hoping that people would stop self-medicating without advice. That technology will come very, very handy in disseminating knowledge, in the reach for patients to be able to get some guidance. And like I said, because there is no way, or there is not enough doctors in the world to be able to go to every village and be able to take care of everybody. So these modalities that are coming up, and Lybrate is one of them, that you can actually benefit the general population by increasing the reach or their ability to be able to connect with doctors who are willing to talk to them and giving them free advice. I think it's a very, very good effort, and I wish you all the good luck.